Hello everyone, I'm Andy Crowne and I lead our healthcare products here at Google Cloud. I'm delighted to be with you here today at this spotlight session for Next 2021. Our topic today is healthcare transformation, and in particular, how COVID has been a catalyst for it. Since we connected last summer at the previous Next, we have seen incredible changes occurring across the healthcare industry at remarkable speed and scale in response to COVID-19. The last 18 months have been both traumatic and transformative across all the stakeholders in the global healthcare ecosystem. They're collaborating at unprecedented levels. Providers are connecting with patients digitally via telehealth. Therapeutics and vaccines are being created and distributed at record speeds. It's become very clear that the availability of data and its interoperability can save lives. As we get closer to the end of the pandemic, it's natural to try and reflect and codify the lessons we have learned. We need to think about the things we must operationalize to prepare ourselves for the next pandemic. Sadly, we've been here before. Looking back at the last truly global pandemic, Spanish flu of 1918, and contrasting it with COVID, you can see the role that data has played in being able to understand the transmission, target effective treatment, and develop a vaccine. Back in 1918, there was limited data to track the spread, there was no vaccine to stop the spread, and there were no drugs to treat the effects. Today, we're able to track data near real time and to a level of granularity undreamt of in 1918. But most of the data infrastructure needed to do this had to be stood up specifically for this purpose. We've caught some glimpses of the future impact of technology on healthcare, one where access to and the interoperability of data is an imperative rather than an obligation. COVID certainly has changed the relationship between care delivery and data. For years, physicians have borne the brunt of lack of data interoperability, and they have long been frustrated by challenges presented by fractured and siloed patient data. To better understand the benefits of data interoperability, Google Cloud commissioned a Harris poll to survey more than 300 physicians across the US. The top 3 takeaways from our research were that data interoperability, number 1, significantly cuts diagnosis time, number 2, improves outcomes, and number 3, saves lives. Our experience with COVID validates this feedback. But we also learned that to be really valuable, the data we share must be timely and in a standardized format, so that it can be interpreted quickly by its recipient. We saw the importance of being prepared with our healthcare data, with our healthcare infrastructure, the availability of PPE, lab capacity, etc. We benefited greatly from being prepared with an mRNA vaccine platform, which gave us a vaccine in months, not years. In order to extract the full power from the data, what we really needed was a ready-to-use data infrastructure. This is why Google has built and recently launched the Healthcare Data Engine. We're trying to speed up the ability to discover actionable insights from healthcare data. In order to do this, the engine needs to be able to speak the language in which healthcare data is transacted today, transform that data into FHIR, the common syntactic and semantic model of the future, and deliver analytics and insights that inform care delivery. It needs to be fast, scalable, and secure. We believe that this approach, fueled by the increasing variety of healthcare data, will enable a wide range of use cases that will accelerate collaboration between healthcare's 2 major stakeholder groups, the payers and providers on one side, the pharma and medtech companies on the other, and better prepare us all for the future. To give you a sense of how Google's technology can be applied here, I have an example. At Google Cloud, we see interoperability affecting the whole continuum of care. From the start, it's helping physicians understand patients by leveraging a 360-degree view of the patient records across various EHRs, incorporating device data, and understanding the community with social determinants of health datasets. Machine learning can leverage this data to help physicians surface new patient insights and can inform their clinical decision-making. Connecting to the right care at the right time is important. Digital services such as telehealth have become a mainstay of care delivery over the last 18 months and are dependent on access to this data. Lastly, we must expand the available services to include those that consider the whole person, whether it's the APIs that integrate with insurance plans, connecting patients to transportation services, or to public health community programs. There are so many more data-powered use cases, and to discuss these further, I'm joined by two thought leaders in this space. I'm delighted to welcome Richard Clarke, who is the Chief Analytics Officer at Highmark Health, and Dr. Purna Prasad, who's the CTO at Northwell Health. To kick us off, I will ask our panelists to briefly introduce themselves and their role and provide a reflection or two on how COVID has changed care delivery in their world. Richard, over to you first.
Thank you so much, Andy. Really appreciate the opportunity to be here. So Richard Clarke, as you mentioned, the Chief Analytics Officer at Highmark Health, where I have accountability for data and analytics. Highmark Health is a blended health organization where we have blue branded health plans with a little over 5.5 million members, as well as a care delivery arm with Allegheny Health Network, 2,500 affiliated and employed physicians, as well as several diversified businesses, so our dental business, stop loss, and a technology business. And truly, as you mentioned in the beginning, it's been a transformational 18 months. We've seen many things happen here at Highmark. I would highlight a few for you. Obviously, the one you already mentioned, that home health and telehealth, obviously truly transformational. Just explosive number of visits there. Although it has been interesting, we've seen some divergence recently where the behavioral health space, those visits exploded and have sustained, with more than 50% of our current visits still occurring via virtual means, whereas primary care and other specialties also saw a tremendous increase in April and May of 2020, but that has started to go back to lower levels, although still much higher than pre-pandemic levels. So definitely areas that will continue to be with us for a long time. The other area I'd like to highlight is I think it also just reinforced something you also mentioned at the beginning around the need to really look at the whole picture of a person and the commitment to both understanding and addressing social determinants of health. We launched our Highmark and Allegheny Health Network community sites in April of 2020, actually, that helped to connect our members and patients to community-based organizations for various services. And we just saw a tremendous amount of use of those sites. Most were looking for healthy food options, as a lot of those were challenged from during the pandemic in terms of being able to get reliable access. And we've continued to see tremendous engagement there, just really reinforcing the investment there and the need to ensure that we're kind of addressing all aspects of a person's health, both their physical, mental, and social.
Thanks for that, Richard. Certainly sounds like you had your hands full during that period. Dr. Prasad, what was it like in your world?
Oh, thank you very much for the opportunity, both to Google and Andy, for this wonderful platform. And it's an honor to be talking to you and Richard at the same time. For us, fortunately or unfortunately, we became almost the hornet's nest when it came to COVID. Being the biggest healthcare system in New York with 23 hospitals, 800 ambulatory centers and going, as well as the School of Medicine, the School of Physician Assistant, and School of Nursing, and Feinstein Institute for Bioelectric Research, we actually took the brunt of it right in the beginning. Yes, the pain was intense. At the same time, innovation basically raised its hood in giving us opportunity to see the data, pitch the data, make data available in an actionable format to all the clinicians and the patients. Now, the biggest challenge was social distancing was needed, not only between patients, but social distancing was needed between patients and the clinicians. And that's where technology played a humongous role. Contact tracing, using cloud-based data repositories, and mobility and instant messaging was almost a boon that we were asking for. innovation took a huge step. And as Richard was talking, telehealth, even though was mature, was always a little bit looked down upon, and people were not comfortable. And that took a 7, 8, 10-fold increase and was actually saved the day for the physicians and the patients to connect with each other. That normal that we saw before the pandemic is no longer the normal. It's the new normal. It is the digital transformation, the huge playground for cloud as well as AI and ML based data to help patients and physicians to serve each other.
Thanks for that. I remember the early days seeing Northwell actually on the TV. So it was amazing to watch. So if you think back a little bit now, hindsight's a marvelous thing. You know, what if you could have made different technology investments to have been better prepared for the pandemic? I'm wondering what those might have looked like. Perhaps Purna, you could pick up from where you left off. Yeah, how might you have been able to get ahead of this with technology investments?
Well, I wish we could have invested almost double or triple of what we invested in the cloud technology, in leveraging the AI and ML, which proved to be the lifesaver for us. We were able to deploy one of the most powerful audio bots using bot technology called as Nora, Northwell Assistant, which almost became the search engine for our varied EMRs and provided the clinicians the right data at the right time for the right purpose. This saved a horrendous amount of time, as well as it enabled care to be provided in an instance. That would be my one investment that I can point out.
Thanks. It certainly seems that this was a race against time. Richard, any thoughts from you about sort of how you may have been able to get ahead with technology investments?
Yeah, I think I would agree with Dr. Prasad. Certainly, if I could have accelerated some of our cloud-based and data infrastructure and interoperability, it probably would have led us to be able to deliver some of the insights faster. I will say though that I'm very proud that we were able to pivot rapidly and provide a lot of actual insights to inform that. I just think it would have been even faster, and frankly the reach would have been a little greater. So we clearly had great connectivity with some of our kind of employed care delivery settings, but if we would have had more interoperability, not only kind of into our broader plan network, but then even into the community and some of those community-based organizations, I think that could have expanded our reach. But those are obviously complicated things to build. But if I could wave a magic wand, I would have said it would have been great to have some of those built in preparation for what we did have to deal with in 2020.
Thanks for that. So it's certainly one of the fascinating things for me about this pandemic has been the availability of data in the public domain. And so I was wondering a little bit, if we zoomed out a little bit, perhaps you could talk a little bit about some of the challenges that you face in your environment, trying to divine insights from, I'm sure, the vast quantity of data that you've accumulated over this period. Perhaps Richard, I could go to you first. If you could give me some sense of where the challenges are.
Yeah, and honestly, I guess I would say if I had to talk about some challenges, I actually would say I don't worry too much about divining the insights at this moment. I tell my team often that if I have a few ergs of energy to deploy, I'm going to deploy them in delivering and adopting the insights that we have. I'm excited for the day when the bottleneck is the creation of the insight, which comes back to a little bit to the theme of the conversation here around the interoperability and the ability to deliver that insight at the right time, in the right context, in the right workflow to drive kind of maximum adoption. And that's really where I would say if we could, for every dollar we might spend on that, we spend kind of 10 more on the driving of adoption. I think that's where we'd be. And frankly, that is a place where COVID has made it a little more challenging, to be frank. We did a lot of co-location of the teams that were working on generation of these insights, shoulder to shoulder, elbow to elbow with those that were using that obviously dramatically changed to us. We moved, 35,000 plus employees home in a week and a half, and went kind of fully virtual. And that's another way that we're not going back. We will be kind of a work from anywhere mentality. So we're looking for ways to rebuild, some of that, connection and interaction, and replicating some of those agile methodologies and agile models kind of in a virtual environment. So that's really the place I would say, if I could, have some challenges solved, that will probably be more in the delivering adoption of those insights.
Yeah, that makes perfect sense. Insights are not valuable if you can't act upon them. So it's interesting to see how challenging it is to put those in front of the right person at the right time. Dr. Purna, how was the world over at Northwell in terms of some challenges maybe that you found operating with the data, or are you seeing what Richard saw, or did you see something different?
Oh, some additional things. I think Richard, hit the nail on the head in terms of interoperability, in terms of adoption. But when we started digging a little deeper, interoperability actually is the first fundamental foundation, and then comes adoption. In between interoperability and adoption, we basically saw something that was so important, that is actionable information. Just feeding the data from a system A to the system B and then sprinkling it all over the EMR was really not helping the clinicians. It was too much of data, clogging. So we saw that really they are looking for very specific data points, for very specific information points. So I call it as drip phenomena. We were reaching a point called data-rich information poor. So the challenge was, how do we provide the information so it is clinically actionable? Number one. Number two, how do we train the clinicians to really consume this? The UI and UX, the user interface and the user experience. Learned a lot in how that can be created in a very fast-paced manner. We are going towards serverless computing thanks to the cloud. We've got applications on the cloud that comes with AI. It's able to learn the patterns, but how do we decipher that and proposition that in front of the clinicians so it is clinically actionable? And that was the biggest challenge. And we did solve some of them through the School of Hard Knocks. But that still is the challenge. And there's still a long way to go in order to make sure we are pitching clinically actionable data in front of the clinicians.
Yeah, thanks for that. And certainly one thing that the COVID data has exposed is the inequities sort of in health outcomes and availability, both nationally and globally. And we think technology can play an important part in improving this challenging issue. Could you share some thoughts that you may have around how you can see technology increasing health equity? Richard, I'll go to you first.
Yeah, what a critically important topic, and one that I think is certainly been amplified during COVID. And what we have seen, and Dr. Prasad, I love what you said. I completely agree with you, and I think we went to the same school for some of that. And so one of the things that also became very obvious, and it's in retrospect, it should have been obvious, but the role that trusted sources really played during COVID was so important. And so we did a lot of work to make sure, especially during the vaccination work, and still do it today, to get to the right sources in the community to deliver the right information, which really allowed us to touch many either challenged communities, underserved communities, et cetera. And that kind of brought in a whole new set of stakeholders to delivering this information. We were doing, we were doing vaccinations on site at senior high rises in some socially vulnerable neighborhoods, and to be able to go there and have a large portion of the population say yes required kind of, again, getting to trusted sources and things. And so it really brought a whole new level of kind of interaction, interoperability to the table to say, okay, well, this set of stakeholders that we're thinking about continues to expand, especially as we're starting to think about the different communities. And if we go by our, one of our design principles, which is really design for all, we need to be thinking about some of these things, and it brings kind of a new lens. And I think it's one that we're going to be challenged to solve, but frankly, to meet our objective, we're going to have to solve. So I think to Dr. Prasad's point is that as you start to peel some of these back, it kind of exposes new layers of challenges. Thankfully, I think the technology exists to solve them. It's really up to us to make sure that we're kind of applying that technology in a way that does, meet the community needs that are facing us.
Thanks. Dr. Prasad, any thoughts from you?
I think Richard hit upon a very important aspect here called as trust. And if you really look at, economically challenged communities or diverse communities, there are certain technologies they trust. And the first one is called the television.
Yep.
The second one may be Google Home or an Alexa that they have because it is cost effective. So we need to deliver content through commoditized consumer level technologies that can reach such ethnically diverse or even economically challenged community, because that is where you have the misinformation that Richard actually talked about, whether it is about vaccine or the other side effects of vaccine, which is really creating havoc right now because of the Delta variant. So we need to, one, make sure that the message is very simple and clear. Number two, use it in the right language in ethnically diverse population using technology. Number three, deliver them through means and technologies that they trust.
Thanks. I think that trust point is vital here. So sadly, our time's nearly up. What I wanted to do at the very end here was really give you the opportunity to share with us maybe one key learning or observation that's really going to stick with you as we go forward in a post-COVID world. Richard, any thoughts here?
Yeah, I'm going to say that this connection between the delivery of actual information and truly saving lives could not have been made more clear than in the last 18 months. And simultaneously with that, the amount of energy and passion that creates within the teams could also not be more clear. I think we worked harder, and I'm sure Dr. Prasad worked even harder, but worked harder over the past 18 months, but we have more engagement and energy and innovation occurring. And I really hope that just does not turn off. And I think we're up to the challenge. So I am very excited about the months and years to come, because the technology is available to us, and I think we have an enormous opportunity to apply it to truly save lives.
Yes, thanks. Some final thoughts from you, Dr. Prasad?
Innovate, 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 but use the stakeholders to design the application and the solution. And here the stakeholders are the clinicians and the patients. We, the technologies, are just enablers. We are not the solution.
I would like to thank both Richard and Dr. Prasad for being with me here today and sharing their thoughts and experiences. I know I found them interesting and thought-provoking. I would also like to thank all of you for watching and wish you a happy and enlightening experience at Next.